Imagine trying to go about your day, but every time you take a step, a bolt of pain shoots down your leg. It's frustrating, debilitating, and feels like your body is betraying you. You're not alone, millions suffer from this nerve pain called sciatica. And while some people feel relief in a matter of weeks, others aren't so lucky. In this video, we'll dive into what sciatica really is, why it can become chronic, and what you can do about it. By the end, you'll have a clear understanding of what's behind your pain and steps you can take to feel better. Section 1. What exactly is sciatica? Sciatica is a nerve pain that typically starts in the lower back and radiates down into your hip, leg, and sometimes even your foot. This pain is a direct result of pressure on the sciatic nerve, which runs from the lower spine all the way to your feet. The main culprit behind this pain? A herniated disc, when one of those discs between your vertebrae slips out of place and presses on the nerve. But that's not the only thing that can irritate this nerve. Inflammation, infection, spinal misalignment, or even certain diseases like spinal stenosis can all cause sciatic pain. Section 2. Common causes of sciatica. Now, let's explore some common causes. 1. Herniated disc. A herniated or slipped disc is by far the most common cause of sciatica. Many people can remember a specific moment, lifting something heavy or a sudden twist, that triggered the pain. Most herniated discs resolve on their own, but when they don't, the pain can persist and become chronic. 2. Spinal stenosis. As we age, the spine experiences wear and tear. This can lead to spinal stenosis, where the spinal canal narrows and compresses the nerves inside. Sciatica from spinal stenosis is more common in older adults. 3. Lifestyle factors. If you spend most of your day sitting, have a sedentary lifestyle, or carry excess weight, you're increasing your risk. Smoking is also a factor that can make sciatica worse over time by reducing blood flow to the spine. 4. Other risk factors. Conditions like rheumatoid arthritis can cause flare-ups, and infections, such as tuberculosis, can affect the spine. Even benign tumors or masses around the spine can press on nerves, leading to pain. Section 3. When sciatica becomes chronic. For most people, sciatica is temporary. It goes away on its own within 4 to 6 weeks. But sometimes, the pain sticks around longer, becomes a constant problem, or goes away and keeps coming back. In these cases, we refer to it as chronic sciatica. So why does it turn chronic? This is where it gets complicated. Not everyone with a herniated disc will develop chronic sciatica, and some cases seem to have no clear cause. For some, repeated injuries, continuous inflammation, or the body's healing process not keeping up with the damage can turn this into a long-term problem. Section 4. Practical solutions for sciatic pain. The good news is that even chronic sciatica can be managed. Here are several remedies that could help. 1. Physical activity. Engaging in moderate exercise like walking, swimming, or cycling can relieve pressure on the sciatic nerve. Gentle stretching exercises, like hip flexor stretches and simple yoga poses, can also help alleviate the pain. The key is consistency, doing a little bit each day to build strength and flexibility in your spine. 2. Healthy lifestyle choices. Maintaining a balanced diet, staying hydrated, and reducing inflammatory foods can also help. Obesity is a known risk factor for sciatica, so reaching and maintaining a healthy weight will reduce stress on your spine. 3. Addressing risk factors. If you're a smoker, quitting can significantly reduce your risk of developing chronic sciatica. Also, avoid prolonged sitting and take breaks to stretch and walk around throughout the day. 4. Seeking medical help. While sciatica often resolves on its own, it's crucial to see a doctor if your pain is unbearable, interferes with daily life, or lasts more than a few months. In some cases, treatments like physical therapy, medication, or even surgery for conditions like herniated discs may be needed. Section 5. Exercises you can try today. Here are a few simple stretches and exercises that may help relieve sciatic pain. 1. Knee to chest stretch. Lie on your back with your knees bent. Bring one knee up to your chest and hold it for 30 seconds. Switch legs and repeat. 2. Hip flexor stretch. Stand in front of a chair. Place one foot on the chair with your knee bent. Lean forward to stretch your hip flexor and hold for 30 seconds. 3. Child's pose. Kneel down with your buttocks resting on your heels. Lean forward, reaching your arms out in front of you and keeping your back straight. Hold for 30 seconds. 4. Marching on your back. Lie on your back with your knees bent and feet flat on the floor. Lift one knee toward your chest as if you're marching in place. Alternate legs for 30 to 60 seconds. Remember, if any of these exercises cause more pain, stop immediately. Always listen to your body and consult a healthcare professional if you're unsure. Section 6. What are the warning signs? Most cases of sciatica improve over time. However, you should contact a doctor if the pain interferes with daily activities, it lasts longer than a few weeks, it's unbearable, or keeps getting worse. There's also the possibility of sciatica being a symptom of something more serious, such as an infection, spinal mass, or even cancer. It's not common, but if your sciatica doesn't improve or if you have additional symptoms like unexplained weight loss, numbness in the groin area, or trouble controlling your bladder, see your healthcare provider as soon as possible. Section 7. The road ahead. While sciatica can cause intense pain, it's usually something that improves with time, lifestyle adjustments, and some simple exercises. For most people, this is not a long-term sentence, it's just a speed bump. And by addressing risk factors, maintaining a healthy lifestyle, and seeking appropriate treatment, you can significantly reduce the chances of sciatica coming back. If you found this information helpful, take a moment to like, subscribe, and hit the notification bell. There's always more to learn about staying healthy and managing pain effectively, and we're here to help. Thank you for watching, and take care of your back, it's the only one you've got.